So Dr. Armson tells me that you're getting the first shot for the HPV vaccine?
Yeah, I don't mind getting it. Actually told me to get it, but I'm a little confused because I thought it was just for women.
Yeah, I think a lot of people hear that too, but it's actually not true. The FDA originally approved the vaccine for just girls, so I think that's why. But both men and women can get the HPV vaccine, and it provides great protection against different types of cancer.
Oh, I thought it also protected against other STIs.
Well, no, it just protects you against HPV, but HPV is a virus with a variety of strands. Some strands cause genital warts. Now, these infections are relatively benign in the sense that they are non malignant, but some strands are more serious and they can cause abnormal and potentially cancerous cell growth. So, the vaccine protects you from 4 strands of HPV. 2 of which can lead to cancer, and 2 of which can lead to genital warts. Does that make sense?
Yeah, I think so.
Okay, so the HPV dose is given in 3 doses, so you'll need 3 separate shots. I'm going to give you the first dose today, then you'll need to come back 1 to 2 months for the second dose, and you'll get the third dose 6 months from today.
Okay, fine. But I don't think my boyfriend got it. I'm gonna ask.
Okay, please do that, and you can tell him that if he hasn't had it to come into our clinic.
Okay.
Okay, so I'm going to give you this handout. You can look that over. Any questions for me about HPV or the vaccine before I give you your shot?
I don't think so.
Okay, so just make sure before you leave that you stop by the front desk to set up your next 2 appointments.
Okay.
All right. So Dr. Armson tells me that you're getting your first HPV shot.
Yeah, I don't mind getting it. Actually told me to get it, but I'm a little confused because I thought it was just for women.
Yeah, I think a lot of people have the same idea, but it's actually not true. Both men and women can get the HPV vaccine to protect themselves from different types of cancer.
I thought it also protected against other STIs.
Well, it only protects you against HPV, which stands for human papilloma virus. But there are lots of different types of HPV. Some cause cancer and some cause genital warts. That might be what you had in mind.
Yes, that's exactly what I was thinking.
Okay, so genital warts aren't dangerous in the sense that they don't cause cancer, but they can be pretty uncomfortable and you can still pass them on to your sex partner. So the HPV vaccine is going to give you great protection against both genital warts and certain types of cancer.
Oh, let's do it.
Okay, so the HPV shot is given in 3 doses, so you'll need 3 separate shots. I'm going to give you the first shot today, then you're going to want to come back in 1 to 2 months for the second shot. And the third shot you're going to get 6 months from today.
Okay, fine. But I don't think my boyfriend got it. I'm gonna ask.
Yeah, please do that. You can tell him that if he hasn't had the shot, he can also come in and get it. And what would you tell him about HPV?
I would tell him that it prevent against some cancers and also warts. They're not serious but annoying. He would have to come in 3 times for it.
Exactly. And just to make sure that you and I are on the same page about when you need to come back, since you're getting your first shot today and the second one needs to be 1 to 2 months after today, tell me what months you will come back for the second and third shot.
I will come back for my second shot at the end of February, and then my third
Well,
shot.
if you're getting your first shot today, and then the second shot needs to be 1 to 2 months from today, when are you going to come back?
December?
Exactly. Okay, so the third shot you're going to get 6 months from today. So when are you going to come back for that one?
May.
Perfect. So I'm going to write down those dates for you. Please make sure that you stop at the front desk before you leave today so that you can set up both of those appointments. So the next one is going to be the end of December. And then your third shot we're going to give you at the beginning of May. Okay? And what questions do you have for me before I give you the shot?
Will I have any side effects, like will I throw up or like get sick or anything?
No, it doesn't make you sick, but the most common side effect we see is a little soreness in your arm here where I'm going to give you the shot just for a couple of days. And some people get a small headache.
Okay, fine.
Okay, so I'm going to give you this handout which explains everything a little bit more. Why don't you just take a few minutes to look everything over, and when I come back in 5 minutes, if you have any questions for me, you can ask before I give you the shot.
Okay, sounds good.